Hey, welcome back to Overhead Athletics. I'm joined by one of our star baseball pitchers here, Izzy. She's sustained a little bit of a UCL injury, had surgery, a primary repair here. We're gonna go through just a RockTape that we like to start to mobilize the scar a little bit for us. It gives her some good sensory feedback. It's not noxious in nature. It's a comfortable sensory feedback, help decrease pain after surgery, but also help to kind of apply a little bit of a mobilization force to the scar that can sometimes be adhered. We have patients a lot of times that have some numbness, tingling into the fingers, and because we don't like to necessarily rub right on this and irritate the ulnar nerve, we can throw some tape on there. So we get two relatively short pieces. I'm gonna cut them down the center so they're split, and I'm going to round all our corners. Now, Izzy's a high school baseball pitcher, and we're going to work on some stuff with her throw. We're already working on strengthening up her forearm to the greatest extent that we possibly can. We're getting her rotator cuff really strong. We're working on a lot of things with her already to get her back, and we see RockTape sometimes as a good little adjunct to an already comprehensive rehabilitation program, and athletes like it. It feels good. It can help lift the skin, assist in recovery times, that sort of thing. Get a little bit of the lymphatic drainage out of there as she builds up some metabolic waste from working a lot of those tissues in the rehabilitation process. And with Izzy here, we're going to show some more videos here in the future and some of the other things we're doing with her. This is one of our favorite UCL taping techniques, especially after surgery, Tommy John surgery, and those sorts of things. So we'll take our tape. These are going to go horizontal. I'm going to have you extend your arm out. Just hold it there for me, right there. So she's supinated here. We're going to cross the scar with these. So I'm going to start back around this back side of the forearm, kind of come underneath with our tape. What we're going to do here is stretch, get a good stretch on this tape, come at the proximal aspect of the scar, and come up and around. So this tape is actually going to pull that way. Same thing here. This tape is pulling that way. We're going to do the exact opposite. So we're going to kind of get differing pulls on the scar tissue here. We'll bring this piece of tape all the way anterior. Nope, not too much. Right there. Good. Right below the crease of the elbow so it doesn't roll too much. And if it does, she can always trim it, or one piece can come off and it's not the end of the world. I'm going to split the other pieces, so I'm going to go right in between. So now we've got a nice pull going that way. And then we're going to bring this tape around, and if this scar was longer, you could see how this would pull on that distal end of the scar. So we've got a nice crossing tape. Sometimes this tape likes to roll, these smaller pieces, so we're going to give us one more piece of tape that's actually going to roll over top of this and kind of just give us a compression over top. Now, is taping going to be the end-all be-all in your treatment? No, it's not, but can it help athletes feel a little bit better and maybe give them some added relief while they're not training? Yeah, absolutely. And we find that it works really well for certain things, especially things that are closer to the surface. So just one with about 50% tension right over the top. If some of these peel, she can just trim them. We'll leave it on there for a few days until she's in therapy next. And that's our RockTape for the elbow. If you guys like this video, make sure you subscribe to the channel, hit the thumbs button, and hit the bell for notifications. Izzy's got to subscribe right after this, and she'll be able to watch herself in this video and then a few more after.